Welcome back. I am so happy to welcome Dr. Michael Collins to the show. He is medical director and founder of Collins Vision. Today we're going to discuss how you can have an opportunity to really restore your youthful eyes, to bring them back to a time when they were actually youthful. And there's a lot of options today with medical advancements, and you're going to kind of lead us through some of those, starting with LASIK surgery. Why has that been so popular in recent years?
LASIK is popular really for lifestyle reasons. People don't want to wear glasses, they don't want to wear contacts. It limits what they can do. So if we can give them their correction and they can go swimming, go scuba diving, do these things that they love to do without the hindrance of using glasses or contacts, they love it.
Yeah, the advancements are just incredible. So when you're thinking about, considering LASIK, who would make a good candidate for it?
A good candidate would be somebody who's 18 years of age or older, somebody who has a stable eyeglass prescription, someone who doesn't have any active diseases going on in the eye.
So what is the procedure like? Is this something that takes a lot of recovery time?
Depends on what procedure you have. With LASIK, generally the next day you're seeing better. With other procedures, it may take a few extra days.
And the good news is if you are not a candidate for LASIK, there are other options out there for you too, right?
There are. Depending on your age and the health of your eye, we may want to do something called advanced surface ablation. We call that ASA. With that, it's essentially a flapless laser vision correction.
Okay.
And that's great for patients who have thinner corneas, maybe have had previous LASIK, need a touch-up. And they're just not a good candidate for LASIK, but they can still do that.
So are either one of these, between the ASA and the LASIK, are they painful?
Neither one of them are painful during the procedure itself. Afterwards, there can be some minor discomfort for a few days.
And how long does that typically last? Is this something you have to go back in maybe 6 months later and get something done again? Does this last for years, or?
That's a great question. We get asked that question every day in clinic. And really, it's a permanent fix. And what really changes inside your eye is the lens, where you start to form a cataract as you get older. So your vision is always going to be better. If you start to form some lens changes, you may need a little touch-up maybe 10, 15 years later. We'll talk a minor touch-up, not like where you were before you had the procedure.
Yeah, incredible. You talk about the importance of choosing a surgeon with a refractive fellowship to determine candidacy. Why is that important?
That's extremely important because this is an elective procedure. It's not something that you have to do, but generally something that you want to do as well as you're going to do well with it. A refractive surgeon specializes in getting patients out of glasses and also specializes in weeding people out who shouldn't have the procedure. You don't want to do the procedure on somebody who could have a bad outcome. I've seen a lot of patients that have had poor outcomes, and it's much easier to do it right the first time than to try to fix it later.
Well, you have a kind of an educational video that really kind of shows the difference between LASIK and ASA. Kind of describe the video and what we're seeing.
Sure. In this video, you're going to see laser vision correction with LASIK, where we make a flap in the cornea. Then you're going to see a procedure where we just remove the skin off the surface of the cornea. That's the ASA, or the advanced surface ablation. That's the one that we call a flapless LASIK, or more accurately, flapless laser vision correction.
And so if you'd like to learn more, your website is?
collinsvision.com.
Okay, so that's a good place where you can watch the whole video if you want to learn more about it and kind of get the big picture and see exactly what's going on and maybe what you're in for. But an even better way to do that is probably to come in and talk to you guys, sit down, have a consultation, and go over things with you face to face maybe.
Definitely. You want to find somebody who's trained that we've talked about, someone who can do the testing, they have up-to-date equipment, someone who can tell you which procedure is right for you.
And the takeaway here, doctor, what do you say? I mean, like I said, it not only builds confidence, but you're going to just feel better all around to know that there are opportunities out there with medical advancements that you can take advantage of.
Exactly. Some people come in, they had their eyes evaluated maybe 10 years ago and they weren't a candidate. Now they come in and there's something we can do for them, and they're really happy.
Well, again, if you'd like more on Dr. Collins or Dr. Collins Vision Center, you can go to our website, fox4morningblend.com.
All right, and up next, what you need to know about honoring the life of a loved one. Stay with us.